Along with all of their hospitals in Rhode Island, South County Health has recently resumed elective surgeries.
If you're considering elective surgery at this time,
there are some important facts we want you to know.
The first is, it's safe to have your surgery.
Our operating rooms and hospital have always been safe and clean.
Today they are cleaner and safer than ever.
Our team has implemented enhanced cleaning practices in our operating room and elsewhere,
including the use of advanced tools like ultraviolet cleaning technology.
For 6 straight years, South County Health has been A-rated for patient safety.
And today, we're doing even more.
Our triage and screening process allows us to isolate any patient suspected of having COVID-19.
In Washington County, we're fortunate the expected surge did not materialize.
And thanks to the enhanced procedures we have had in place for months,
South County Health is actually one of the safest public places in our community.
Remember, if you delay an elective surgery, your condition may actually get worse.
So if you need to get a procedure done, now is a great time to do so.
We're excited to welcome you back to an environment that offers the highest level of protection and safety.
South County Health.
We're open,
safe,
and ready.
As you just heard, we have resumed elective surgeries. South County Health is now in the recovery phase of the COVID crisis. The resumption of elective surgery is the first step to reintroducing all of our health services to the community. Our top priority, of course, is ensuring the highest level of safety for our patients and staff.
we're here for our community, and we're here to think out of the box, and we've been doing that from day one. People have put off their surgeries for quite a while now. We're going close to about 2 months. I believe it is absolutely safe, and part of it has to do with not only the measures that we've put in place here to ensure our patients' safety as well as our staff safety, but it's also taking into account the viral load that we're seeing into the community. We are in direct contact with the Rhode Island Department of Health, and we are constantly monitoring the viral load within our area. And as many of you know, we have a different viral load from what they have in the northern half of our state, and we keep an eye on that. We have set up all kinds of protocols. We have enough supplies within the hospital to do this safely now and to keep everybody safe.
The response from South County Health has been a total team effort from the start.
We had set up what's called an incident command system. We on a daily basis would have a meeting with all of our, we call service lines, and all the different departments, anything from environmental services, housekeeping, to our physician staff, our nursing staff, infection prevention, supply chain. Everyone was at the table, which is really good because we could share information very rapidly and we could respond to things that were happening on a daily basis. And it was updated all the time, and we interfaced very closely with the Rhode Island Department of Health, and as well as what the CDC was providing us as well. That was probably one of the most important things that we did early on, and we continue to do on a daily basis.
More than any health system in Rhode Island, South County Health is known for its quality, safety, and service. At this trying time, our caregivers knew the difference that communication would make for the families of patients.
We are very compassionate in regards to the care we deliver to patients in general and in the ICU specifically, because of the nature of the sickness in the ICU. From day number one, we all talked about the importance of, clear and continuous communication with the patient's family, in this case, her husband, and we knew how difficult it was. It was very emotional, honestly, for all of us, myself included. We made sure that we communicate every single detail with the patient's husband and update him in full transparency about what's going on. And I think that made a tremendous effort in building up the level of comfort and confidence in the care, their loved one is receiving at South County Hospital. We had to be creative as far as the tools we're going to use, the medications we're going to use. So it was very exciting to see her getting better and getting off the mechanical ventilation and eventually discharged home from the hospital. So that was very satisfying and very pleasant feeling.
During this challenging time, we've been joined by a talented leader in Anitra Galmore, who joins us as our Chief Operations Officer and Chief Nursing Officer. Anitra quickly saw firsthand what our staff and community was all about.
I have been very impressed with the responsiveness of the team, and their willingness to go above and beyond what is required on a day-to-day basis to ensure that our patients are served in the best way possible. The surrounding community has been extremely important. As we drive into work, we're able to see people out on their porches and have signs up encouraging team members on the way in and also on the way out. So that really fills our cup. We are here to serve, but it's also important that we take care of each other. And I see that actively demonstrated at every level of the organization. I'm very proud to have joined this team.
The community has continued its tremendous support, donating a wealth of items to our team in support of our response to this crisis. Arrowhead Dental Associates donated several boxes of surgical masks to South County Health.
Hi everyone, I'm Dr. Brendan Gouen, and on behalf of everyone here at Arrowhead Dental Associates, we would like to thank the entire team at South County Health for all that you do and continue to do to help fight COVID-19. We know how important personal protective equipment is in the fight against COVID-19, and for that reason, we were more than happy to donate masks. We know you'll put them to good use. We appreciate all that you do, and again, thank you guys so much.
Support has also come in the form of signs, donations of food, and letters. A special group of students from Charlestown Elementary School took the time to write to our team, giving them special encouragement at this challenging time.
Dear hospital workers, thank you for taking care of us. I think what you do every day for a job is very brave. My family thinks about you a lot. Love, Griffin.
I hope you are taking good care of yourself and all the people that have the coronavirus. This virus makes me sad because we can't go anywhere and we can't see our cousins or sisters. You are brave and helpful. If you were in my class, you would be a shining star. Thank you. Bob, Margaret, Rita, Whittier.
Thank you, doctors and nurses, for taking care of everyone when they are sick. Thank you for giving checkups and sometimes stickers. Thank you for helping us with the coronavirus so we don't have to cough and sneeze a lot. I hope you're having a good day every day. Thank you so much. Love, Nora.
This crisis has reinforced the importance of a community sticking together. At South County Health, we look forward to caring for you in the coming months with the high-quality, compassionate care you've come to expect. As always, our staff is ready. Thank you so much for your ongoing support. We truly appreciate it.